Assalamualaikum. My name is AINUN SYAFIQAH binti MALEKI, NOOR Matric 293617, and this is my partner.
Assalamualaikum and hi, my name is SYAWALTOL HAWA binti NAIDI, matrix number 293721.
Now, we are going to discuss about our topic, which is mental health issues. Okay, what is mental health? Also we call it with mental illness, refers to a wide range of mental health conditions, include disorder that affect your mood, thinking, and behaviors. For example of mental illness include depression, anxiety disorders, schizophrenia, eating disorder, and addictive behaviors.
Now I would like to share about the symptoms of mental health issues. There are various symptoms that can indicate a person is having a mental health problems. First and foremost, the symptom is feeling sad and down. These symptoms coming when the person having a lot of problems such as family issues, financial problem, relationships, and others. So, this problem can cause the person feeling sad and down in that situation when the problems cannot be solved. Second is confused thinking or reduced ability to concentrate. It is because when the person who having a lot of problems, it can make them think too much about it. So it also can cause of mental health problem. Besides, think too much about the problems can make the person lose focus on their job. The other symptom is excessive fears or worries and feel guilty. For example, people who is facing with the family issues such as abuse and domestic violence, this problem also can cause the person to have a mental health problem. So these symptoms coming when they feel fear when remembering that situation or problem. Besides that, extreme mood change also the symptoms of mental health issues. These symptoms can lead the people to become angry in some situation. This is happen because when they think too much about their problem, they will be distracted and cannot control their mood in some situation. Next is significant tiredness, low energy, and sleeping problem. These symptoms happen because when the person having a lot of problem, they will think too much about the problem, especially when they want to sleep. So this will cause the person having not enough sleep. When the person not having enough sleep, they will facing a problem on managing their daily life. The last is suicidal thinking. This is the bad symptoms of mental health issues. These symptoms happen when they feel that their problem cannot be solved and they think the suicidal is the best way to stop their problems. So these symptoms must be avoided from happening and have to get the treatment as soon as possible.
Thank you, Hawa, for your explanation about the symptoms of mental health issues. Now, let's move on to causes of mental health issues. The first one is mental illness in families, or we also call as genetics. As we know, mental health issues are often seen as belonging to the realms of psychologists, but recent research has shown that genetics plays a significant role in many mental disorders. In fact, according to the National Institute of Mental Health, approximately 50% of all mental illness is caused by inherent genetics or biological factors. The next one is abuse. As you can see on the slide, abuse can include physical, sexual, emotional, or verbal abuse and can also involve bullying or neglect. Abuse can occur in childhood or adulthood. Unfortunately, it is all too common. One in five women, one in six children, and one in 20 men will be victims or sexual abuse at some points in their life. When abuse is experienced in childhood, it can have a profound and lasting effects on mental health. Children who are abused are most likely to develop anxieties, depressions, post-traumatic stress disorders, and other mental illness. They may also be more likely to turn to substance abuse as a way of self-medication. The another causes is the loss of the loved one. It is one of the most difficult experience a person can go through. It is natural to feel grief, sadness, and angers when someone close to you dies. However, for some people, these emotions can become so intense that they develop depressions or anxiety. In some cases, the death of a loved can be sudden or unexpected, such as an accident. This can make it even more difficult to cope. Sudden death can lead to feeling of shocks and confusions, which can be very distressing. Loved ones are usually those who give our lives meanings and purpose. So when they gone, it can be hard to find a reason to keep going. The last causes is trauma. Trauma, it can lead to symptoms such as post-traumatic stress disorder, flashback, nightmares, anxiety, and major depressions. Trauma also make it difficult to trust other people, which can lead to social isolations. Some people who have experienced trauma may also develop substance abuse problem as a way to cope with their pain. This can feature compound the problems and lead to a downward spirals of mental illness and addiction. Traumatic events don't always need to be the big life altering event that we typically think of. Sometimes it can be the accumulation of the small daily life traumas that have a significant impact on our mental health. This is especially true for marginalized groups who has experienced multiple forms of discriminations and violence.
Now, let's talk about the mental health related issues. There are many types of mental health issues and illnesses. First and foremost is stress or depression. Depression is a mood disorder characterized by lowering of mood, loss of interest and enjoyment, and reduced energy. Depression is the big risk of the mental health issue because it can lead to increased risk of suicidal thoughts of behaviors. Secondly is anxiety disorders. Anxiety disorder is a group of mental health disorders, generalized social phobias, panic disorder, and others. Anxiety disorder can lead to significant impairment on people's daily lives. Next is schizophrenia. Schizophrenia is the complex psychotic disorder characterized by disruption to thinking and emotions. Symptoms of schizophrenia may include hallucinations, delusions, impaired thinking, and memory. Schizophrenia also have a high risk of suicide.
Thank you, HAWA, for your explanation. Now, let's move on to the last thing we include in our presentation, which is prevention. There is no definitive way to prevent mental health problems, but if you have mental problem, you should take steps to control them. So, let's follow this step. The first step is pay attention to warning signs. Work with your doctor or therapist to learn what will trigger your symptom. Make a plan so that you know what to do if symptoms returns. Contact your doctor or therapist if you notice any change in symptoms or how you feel. Consider involving family member or friend to watch for warning signs. For the second step, get routine medical care. For the patient, don't neglect checkups or skip visit to your primary care provider, especially if you aren't feeling well. Maybe you may have a new health problems that need to be treated, or you may be experiencing side effects of medication. The next step is get help when you need it. It's very important because mental health conditions can be harder to treat if you wait until symptoms to get very bad. Long-term maintenance treatments also may help prevent a relapse of symptoms. The last step that can prevention your mental health is take good care of yourself with educate your sleep, healthy eating, and regular physical activity are essential. So you should try to maintain a regular schedule. Talk to your primary care provider if you have sleep problem or if you have question of diet and activity physical.
The conclusion is it is important to take good care of mental health. It is because there are many effects to the person who is having a mental health problems. So, we have to aware about how to solve our problem nicely to prevent facing mental health problems. Therefore, it is also our responsibility to keep our mind stay positive and try to find the best way to solve our problems. The effect is our daily life will become peaceful and live happily. Thank you.
Thank you for your smile.